Hello guys, today we are going to study rectal prolapse. Here is the definition of rectal prolapse. Rectal prolapse is actually the protrusion of mucous membrane or entire rectum outside the anus. Here in this diagram, you can see that this mucous membrane of the rectum is coming out of the anus. So there are two types of rectal prolapse. One is the partial prolapse and the other one is full thickness prolapse. Let's talk about partial prolapse first. In partial prolapse, only two layers of the rectum, mucosa and submucosa, these two layers protrude outside the anus for 1 to 4 centimeter. And on palpation, these two layers are composed of a double layer of the mucous membrane. This partial prolapse is common in infants and in children. In infants, it might be due to undeveloped sacral curve. This sacral curve, when developed, serves as a support to the rectum, and when it is not yet developed, the support to the rectum is reduced and it might lead to some partial prolapse. In children, partial prolapse might be due to loss of fat in ischiorectal fossa. It might be due to diarrhea, or it might be due to weight loss. Here in this diagram, you can see in partial prolapse or in mucosal prolapse or in incomplete prolapse, only two layers, mucosa and submucosa of the rectum, protrude through the anus, while in full thickness prolapse, all the four layers of the rectum protrude through the anus. So what could be the treatment of partial prolapse? In children, there are three treatment options. One is digital reposition. Second one is submucosal injection. So injection is of 5% phenol in almond oil. It serves as a sclerosing agent. This submucosal injection induces an aseptic inflammation, which leads to formation of adhesions between mucous membrane and the muscles, and it prevents the protrusion. So third option is surgical removal of the prolapse. In adults, first option is submucosal injection and then excision of prolapsed mucosa. Full thickness prolapse. In full thickness prolapse, all the four layers of the rectum, they protrude through the anus more than 4 centimeter. It can be as much as 10 to 15 centimeter. On palpation, they are thicker than the partial prolapse and double layered. So what could be the risk factors which lead to full thickness prolapse? So first one is old age. This full thickness prolapse is more common in old age, and it is more common in female gender. Old age and female gender, these two are more concerned with full thickness prolapse. Third one is the people who take antipsychotic medication are also at an increased risk of developing full thickness prolapse. If a female has previous history of hysterectomy, or a person has some spinal cord injury, he or she is also at an increased risk of developing full thickness or complete prolapse. So let's talk about treatment of complete prolapse. Surgery is the treatment of choice for complete or full thickness prolapse. This surgery can be performed via perineal approach or via abdominal approach. Three procedures or operations are here via perineal approach. First one is Thier's stitch. Number 2, Delarme's operation. Third one is Eldemir's procedure. Via abdominal approach, first one is Wells operation, and then is rib stents operation. Thank you so much.